So good evening, participants, and welcome to our third webinar series, our next gen digital health using the Open Health Stack. So far, we've covered Open Health Standards. We've gone through the WHO SMART guidelines. And today we look at the Open Health Stack. And our facilitator for today is Fred. He'll introduce himself further as we proceed. Welcome, Fred. Let's proceed.
Great. Thank you, Dr. Moses, and very good to be here. Please feel free to leave questions in the chat. I'll ask Dr. Moses if anyone's having a problem hearing or anything. I won't be monitoring the chat during the presentation, but if you can let me know, and please feel free to interrupt if need be. All right. So really great to be here and to follow up with this third webinar in this series. And this is really around introducing Open Health Stack, about building digital health solutions with open technologies. So my name's Fred Hirsch. I'm a product manager working at Google Health. I'm usually based in Singapore. Today I find myself in Bangalore in India. I'm a medical doctor by training, a lapsed engineer before that, and I've worked at the intersection of health and technology for a good 10 or 15 years, and I'm really excited about the potential for technology to improve access to healthcare. So very pleased to be I wanted to do a quick recap of the series so far, and then I'm going to introduce you to Open Health Stack and the idea of open technologies, run you through what are the components of Open Health Stack, share with you some of the ways that developers are building on OHS today, and just a few thoughts on how people can get involved if they're interested. Okay. All right. So I'm sure you're all very familiar with this, but it's always, I think, helpful just to recap, kind of why we're here. Right? So we see around the world, there really is a huge need, ongoing need to find ways to improve access to quality healthcare. Right? So over half of the world's population don't have access to good quality essential health services. Lack of access and quality together contributes to 9 million preventable deaths every year, 60% of those due to poor quality, which can really mean not getting access to the kinds of evidence-based care that Garrett and the WHO team talked about last week. This is mostly impacting communities in low resource settings, and this is really exacerbated by the growing gap in terms of healthcare workers. So, even more need to be able to figure out how do we enable community health workers to help to address this. And so we've heard over the past couple of weeks in the webinars, and if you haven't seen them, there will be recordings available. But you've heard about these ideas around open, like why standards and architectures matter. So Stephen gave a great presentation on that, and it's really about HL7 Fire on the one hand, offering in many ways like a response to some of the challenges that we'll talk through, but as a new open standard that's being widely adopted across healthcare, and particularly being seen as a really opportune technology or approach to be able to address some of the problems that we've seen, right? And FHIR is important because it's both represents a data model, defines a common data model for building digital healthcare solutions, and a set of APIs and the specification for really facilitating effective exchange of data. Right? So that's important. Stephen also touched on open architectures, and these are really the design patterns, for how different systems can start to interoperate and exchange data more effectively, and a part of an enterprise architecture that also includes things like terminologies, right, and the data governance and those types of structures that need to be in place to have an effective digital health ecosystem. right? And Garrett and the team talked a lot about this idea around open content. So how through adopting a standards-based approach, there's an ever-growing portfolio of quality content, things like the clinical guidelines, like the SMART guidelines that they presented, decision support logic, but also, basic questionnaires and the value sets or the terminologies that we want to map that data to that can be readily shared, adapted, and deployed. And so by, taking this standards-based approach, we make that more readily available to the ecosystem. And really, I think what we've been talking about over the last few weeks and what it kind of boils down to is that interoperability, right, enabled by standards, open standards like FHIR, is really kind of seen as the key to shifting from a kind of a program-centric approach where we just think about specific disease verticals to really a much more person-centered one. And Garrett would have talked a lot about that. And so these are really just some. If you look at this slide, this is an approach that's been widely endorsed by all of the leading digital health groups, donors, multilateral organizations, the WHO, and is really embedded in a lot of the principles that drives the community in global digital health going forward. Okay. So just reflecting on that and the problem that we find ourselves with kind of still today, since the very early days of mobile telecommunications, there's been a lot of interest in figuring out how to use mobile phones and increasingly smartphones and others to help address the problem that we see in terms of gaps, in terms of access to quality care. And we certainly, Google and our work and part of this community, we certainly believe that mobile and AI can help to extend access to quality healthcare for all. But to date, if we look back at kind of where we've gotten to, there have been challenges in really realizing the potential for mobile. And these are, just some of those challenges. So things like, the lack of a common standard has meant that digital health solutions have not really been able to fully deliver on the promise and have actually created other problems, things like data silos, right, which further makes interoperability difficult and expensive to achieve, right? And so we've seen FHIR emerge now, and we're learning about that and why that's important. But it still can be difficult and expensive for developers to adopt these into new or existing solutions, right? And so really that's kind of the problem statement, is that building interoperable digital health solutions that can improve the quality of care is to achieve. And so that's where this idea of open technologies, we talk specifically about Open Health Stack, but open technologies are open access software and infrastructure that make it easier to build solutions that can leverage these open standards like FHIR. CQL is another part of the FHIR specification. And so there are a number of open source technologies, and this is by no means an exhaustive list, but these are just some of the kind of common ones that are used, things like FHIR servers, right, to manage and store data. So, effectively your data model implements the FHIR specification, such as from HAPPIS. That's a very common, popular open source version. Form authoring tools. So when you get into, writing questionnaires for data collection and other elements of authoring around FHIR. So there's a project called LHC Forms. And if you're looking to, generate synthetic data, there are some tools out there from MITRE, the Cynthia project, that you can go and get synthetic data, right? So you can test out your solutions and evaluate how things work and learn about how to work with FHIR as a data model, for example. And of course, new libraries and components specifically for developers. And that's really what I'm excited to share with you today, which is our work with Open Health Stack, right? And I thought I'll just kick this off by sharing a little video that we made together with Dr. Moses and Stephen from Intellisoft, about how to tell the story about how Open Health Stack is making it easier for developers to build solutions today. But I can see that I'm just going to have to stop sharing for 1 second. Not sure if I can. Okay, here we go. Are you able to hear that?
Good to go, Fred.
Great.
Every day, I wake up very early in the morning. I have a lot of work to do. I'm a CHV, Community Health Volunteer.
We call it a community health volunteer. We mostly target pregnant women, visiting them, check up on their mothers.
Majasmine. If we didn't have the CHV, we will lose a lot of babies because there's nobody to come and educate the mothers.
When Stella came, she told me you have to go to clinic as early as when you get pregnant so that you can be monitored. Wow, good.
So much of my job is recording information. The records are very important for the mother's health. I have books, even they can't fit in my bag, you see. I really like the app because I don't need to carry all these things. I go to the app, I see everything about the mother. The app is very, very good.
Good afternoon. We're here with my team to introduce Mama's Hub to you. Mama's Hub is a solution designed to be able to capture timely information about an expectant mother in the entire continuum of care.
This is how it looks. You'll see the client and you're going to be able to see all her details.
Timely, accurate, complete information. Enough for the health facility to save life.
I'm probably too emotional about the work I do, so I think a lot about how can I use technology to improve people's lives.
When we were starting to work on the development of Mama's Hub, we were constrained for time and resources. Intellisoft told us about Open Health Stack and its capacity to help us deliver quickly. It made us feel empowered.
I look at Open Health Stack as having a Ferrari in your hands.
Open Health Stack is a suite of open source components for building next generation healthcare apps. These are standards based, they're offline capable, secure, and adaptable to different healthcare settings.
With Open Health Stack, it means that you've got all these building blocks. I'll put them together and I'll very quickly build a solution. Without Open Health Stack, Mama's Hub first prototype would have taken us about 9 months. With Open Health Stack, we reduced the 9 months development lead time to 3 months. Yeah, literally. With the Open Health Stack, Google deliberately designed from scratch for an environment where resources are very scarce. This tool that I'm putting in a woman's hands needs to give her the same exact privileges as somebody who's living in New York.
Every mother should understand how your health is doing. I think it is important for the mother and for the unborn baby.
When a mother is expectant, she needs that care. She needs that love. When you're happy, even the fetus is happy. When you're strong, even it is strong. You find that it kicks. I just thank God that Stella and the rest of the community, they just decided to come and assist these mothers. It is awesome.
Okay, great. I hope you enjoyed that. I always love seeing that film, and I feel like it tells the story so well about what we're doing. So it's always a hard act to follow, but it's a nice way to segue into the mission behind this work, right? So our team's mission is really to make it easier for developers everywhere to be able to realize the promise of digital solutions and be able to more effectively work with standards and FHIR, make it easier, which can really help to address these equity gaps and make data-driven, person-centered healthcare more accessible to all, right? And so we talk about accelerating the development of next-gen solutions. And what we mean by next-gen is that these are built on modern standards, so such as FHIR, that can really promote the flow of data, which is interoperability, and make person-centered care possible, okay? That are data-driven, that bring evidence-based decision-making to healthcare workers everywhere. So whether that's at the point of care, so for example, some of the work that the SMART guidelines, the WHO talked about about bringing kind of evidence-based clinical decision support to healthcare workers, or making it easier to get answers from data via dashboards, and really creates a marketplace of innovation. So we really want to see Open Health Stack really help to bring forward and help to stimulate innovation and make kind of game-changing capabilities like AI capabilities more available and be able to be easily incorporated into care by developers using Open Health Stack. And so introducing Open Health Stack, it's a suite of open source components and resources that help to accelerate the development of these solutions. And the idea is that with Open Health Stack components, developers are able to save time. Example, the Android Fire SDK, which makes it easier to build Firebase apps that can operate like fully offline. Right? So this is really important, obviously, in areas where there is a lack of reliable connectivity, and that's often where the need is the greatest. Right? And so OHS helps developers to build faster and unlock the potential in the data, and really kind of to build solutions. So it's a set of building blocks to build solutions on top of. Beyond that, we've also been working with the community on design guidelines, which we think are really important, as well as to share best practices around how to improve the user experience, looking at things like data collection, syncing, and others, and really to share best practices. And we've got some case studies or stories that we'll talk through in a little bit, as well as a set of developer resources to get started quickly. Right? And as I mentioned, in the long run, we really see that this has an opportunity to enable advanced capabilities, whether those be through mobile sensing opportunities, AI, ML, on diagnostics, and today we obviously are talking about large language models and how that can really help developers to build, better solutions, right? And so together, these components form the foundation for developers to build standards-based solutions that are then powered by OHS. So at the bottom in the purple there, you can see those are the OHS components, and there are some new ones that we've just released recently on the analytics side. And then at the top, you get a sense of how developers are using these as building blocks to really kind of power these solutions. And I will say just quickly now, these components can be used individually as well as together, and we'll get into that in a little bit more detail. So basically, the idea is that OHS can really reduce some of the complexity of working with standards that we know is there, so it can reduce that barrier to entry for developers everywhere. Right? I think what's really different about this is that we're moving away from building towards a specific kind of platform or specific kind of data model to building on an open standard, right? So that means that if you're building to an open standard, many applications can leverage that same common data model, right? Which is a really kind of powerful change and enables a lot more local innovation and a lot more local developers to be solving important problems, right? So today, what we see is that there's a lot of time and effort, right, to build and maintain complete solutions, common data models, all of the syncing, all of the components. With Open Health Stack, we try to kind of take away a lot of that and make that literally invisible, so that local innovators can build solutions to solve local problems. And it's been really important to us to align Open Health Stack with the Digital Public Goods Alliance, which recognizes our commitment towards helping countries achieve the Sustainable Development Goals. And the Android Fire SDK is also a digital square kind of global good for health. And we've been participating in that community and part of that ecosystem. And we've been working with the World Health Organization and the ecosystem to really advance digital health. So this is a community effort. We're really excited to be able to to be able to partner and now formally collaborate with the WHO to improve public health. And as I mentioned, part of be part of the emerging ecosystem around fire, and also the existing global goods community that's also rallying around standards and interoperability and other things. Okay. So I'm going to just take a moment, and I'm going to talk you through the components of Open Health Stack in a little bit more detail. I'll just see if there's any questions. No. Okay, David asked, what does AI-powered healthcare entail? So I think, David, that's a really good question, and we use that term. I mean, I think we see that there's a lot of AI capabilities that can further expand and increase access to quality care, right? So at the basic level, we want to be able to improve the data that's flowing through a system. By promoting standards and by promoting interoperability, we enable person-centered care, which means that health workers have the information they need to make better decisions about patients, like when they need them, or citizens when they need them. And by AI powered, we mean that there's a lot of different capabilities that are being developed that can further enhance, the decision-making abilities, can further extend the reach of expertise closer to communities, and also be able to have better quality data to be able to kind of train and develop and deploy, new local models that can help those things. So we're really talking about establishing a foundation that can take advantage of, new and emerging technological advancements to further drive, access to quality care. All right. So with that, I'll dive into the OHS components. There's a link here to the developer site. So there's a developer site that has all of this content in it. If you want to learn more about Open Health Stack, you can go there. So I'm going to kind of step you through the components and just talk through how they're kind of used at this stage, but there's more information available on that developer site. Okay, so the first component is the Android Fire SDK, and it kind of is, as it sounds, it's a software development kit that makes it easier for Android app developers to build Fire native solutions, right? So this is really about being able to build a new application that really leverages the full kind of data model that Fire enables, to be able to deploy that in offline first capabilities, make it really easy to take things like Fire questionnaires, so the content that Garrett and the WHO team would have talked about, be able to turn that into a user interface like very, very quickly, so you can do data capture, and obviously, do form data collection, which is a core part of most healthcare applications. It also includes advanced capabilities for enabling things like workflow, right? As well as on-device decision support, the ability to be able to execute decision support logic. Oh. Okay. And so this is how, as a kind of an application, using the Android Fire SDK, the blue at the top is like the application, so it would incorporate the SDK into the application. You can see there's a link to a Fire server, so you can sync data very effectively between a Fire server and that device, and so you can then have full offline capabilities, as well as all of the data access APIs that you need, search capabilities and other things to be able to build a very rich Android-based application that is now Fire native. So you're now working with Fire, promotes better exchange of data, better interoperability in the future. The second component that we have is called the Fire Info Gateway. And this is really about making it easier for implementers to be able to bake into their solutions the ability to enforce access control policy. So it's a little bit of a technical component, but it solves a bit of a blind spot that exists for implementers, trying to deploy solutions where they have to, where they want to and they need to be able to enforce the access control policies over the data, right? So it makes it possible to do that in a way that is effectively agnostic to the Fire server it's not baked into the Fire server. It's actually a standalone component which has advantages, right? And because of its architecture, it can be adapted to different settings based on the needs of implementers. So this is what kind of it looks like when you look at the Fire Info Gateway. So now we've got our it's sitting in between our Fire server and the Android Fire SDK there, which has the application that's been built into it. So in this instance, it can help to enforce the organizational control policies. As I said, it also enables Smart on Fire integration. So if you have Smart on Fire apps, probably another topic for another time, the Info Gateway can help with the authorization and then enhancing also sync operation. So that's a particularly important use case where you want to be able to constrain what patients a specific like healthcare worker should have if they're going to then take that and be offline and work on those records. So it kind of provides some optimizations to make it easier to do that. Okay, moving on to analytics. Obviously, extracting meaning from data, generating insights from data is really a core part of any type of digital health solution. And we know that Fire data, whilst it's very good for representing a data model and has lots of benefits in terms of the specification and the design, it can make it difficult to analyze data, right? So there's a heavily nested structure, can't really write standard SQL queries against that. So with the Fire Analytics, we really want to make it easier to be able to generate those trusted insights, right? So this is a combination of pipelines and query libraries that can help developers to develop dashboards and generate these insights faster. Right? So this is what we basically do with the Fire Analytics. Is the pipelines can take data from any Fire source. So this could be a Fire server that's storing data natively in Fire, or it could be that as part of wanting to kind of transform data from a non-Fire to Fire, you have a Fire facade, and that's like not an uncommon pattern, right, for existing systems. So you can have once you have a Fire source, what the Fire data pipes does is it's a set of pipelines or a pipeline that transforms that data into a common schema. So what we're actually doing is transforming data into the SQL on Fire schema that then makes it possible to write SQL queries against that data. So now I can start to write SQL queries. Those queries can be kind of quite complex and can be a little bit intimidating. And so we also have what are called Fire Views, which is a kind of a query library package that then allows you to use kind of basic kind of Python and FirePath notation to be able to more easily describe the kinds of views that you might want to have. And what we mean by a view is we're taking what would be like a very big table, and we're kind of constraining it down to just the fields that you're going to need to kind of power a dashboard, for example. So now once I've got these views, I can now write simpler queries, common SQL queries, and connect that to dashboarding tools, things like Apache Superset or others to start to visualize my data more easily. You can also connect that to a Python notebook to be doing more data science. And there are more capabilities that we're looking to enable, things like running data quality metrics on top of that data. So because we've got this common schema, it's now possible to really kind of from a community point of view, start to think about what are the additional capabilities that we can extend. So this can support multiple use cases. So extension of like a non-Fire solution. I'll talk about that in a second, as part of a standalone analytics solution that's leveraging Fire, or obviously as part of an end-to-end digital health solution. So these are the kind of modular components that you can easily put together. And then the last example that I did want to just touch on is this idea of like hybrid architectures, right? So I think it's important to understand that there are lots of benefits and lots of ways to kind of take advantage of the benefits of Fire, right? So in many places, there's existing investments into digital health solutions. Some of those are not Fire today, but people are looking at either in ways of transforming or mapping that data to Fire, either as a one-way or as a two-way kind of mapping. So things like Open Health Stack, the fire analytics, can really kind of help to preserve existing investments and de-risk the cost of transforming to fire. So now I go through the process of transforming. Instantly, I can leverage something like fire analytics, and I can start to deploy analytics solutions on that fire data that I've just spent time transforming to. So I think that's an important, very important, and we're thinking and add a lot of value to the ecosystem. Right, we're also developing design guidelines and sharing best practices. So this is an example. You can go to the dev site again and go to /design, and there's a couple of design guidelines there, and there are some additional ones that are coming as well. So all of this is available on the developer website, as I said. All right. So, we've been really excited to see how our early adopter partners, of which there's a number of them, have been building new fire-based solutions and the impact that it's having for them. So what we've seen really consistently is that by building with Open Health Stack, developers are saving valuable time, right? Getting their solutions into the field more quickly. So I just wanted to quickly step through that. Obviously, on the video, we heard Stephen, talk about the time saving that the team had, in reducing that lead time for the first for their kind of, I think, early MVP of the Mama's Hub platform in Kenya, right? And we're really excited to continue working with the Intellisoft team as they're adopting other OHS components into this and other solutions. Another partner is Ona, who are the stewards and developers of the OpenSRP platform, and we've been working with them also for a long time on leveraging OHS to really transform the OpenSRP platform to be a Fire native platform. So now OpenSRP V2, or they call it Firecore, is now a Fire native, and it's leverages a lot of the OHS components to be able to do that. And it's really helped them to be able to take that leap into Fire and to build this exciting kind of community health information system platform. Another example is a partner called IPRD, who've built an Impact Health app. This has been deployed in Nigeria. This was deployed in Nigeria kind of towards the end of last year. And they're building both on the Android Fire SDK and also on the Fire Analytics. And for them, it's really about trying to get to this kind of trusted time, faster time to trusted insights, quicker. And it's been great to see their journey. And then lastly, and maybe Garrett and the WHO talked a little bit about this last week when they talk about the smart guidelines. We've been working with Argosoft, who's their technical partner, and the team from WHO to bring these smart guidelines to life on the Android Fire SDK, right? And so here's another quote from Kunjan, who's the group lead of their technical partner, in terms of how it's saved them a lot of development time and really made it possible to be able to do a lot of the complex logic that exists within the smart guidelines on Android. And so one of the big capabilities that we've brought is really kind of CQL evaluation, which is a very technical capability, but it kind of enables things like on-device decision support based on a Fire specification. And so we're looking, these are just some of the stories that we have to share today, and we're excited to kind of continue to share these, and you can read more details about them and the kind of impact that this is having and the work that the teams are doing on the developer website, as I mentioned. Okay, great. So just coming towards the end, I wanted to share just a couple of slides on getting involved or learning more, right? So if there are technical people out there, or you work within an organization where you have technical teams or you interface with technical teams, we've developed and will continue to share more kind of resources for developers, right? So for all of the components that I've shared, there's a number of different GitHub repositories. We have pretty good documentation, and we're always working on making it better for all of those components, and the developer site is the best place to start. For the Android Fire SDK specifically, we have some demo applications that you can actually, download the code, you build it yourself, and you can start to see for the data capture, you can see how all the widgets will get displayed in a questionnaire using a questionnaire resource. And similarly, there's a kind of a demo app that can show you some basics around syncing and putting together the beginnings of a digital health application. We also have an end-to-end example repository that connects the Fire SDK with a Happy Fire server through the Fire Info Gateway. And then we have instructions for then also adding the analytics pipelines that we mentioned, and then connecting that to build a dashboard. So you can start to see how the components can fit together and support an end-to-end solution. And we also have some developer tools, some tutorials, and code labs that can help you or your teams get started quickly. And so lastly, really an invitation. We are part of an open community building around the FHIR standard to advance global digital health. These are just some of the groups that have made contributions to the work. So there's always opportunities to actually contribute code if there are developers out there. But there are also other ways to get involved. So the WHO runs an implementers call around the SMART guidelines that we participate in on a Tuesday. We run bi-weekly developer calls. Today, those are focused on the Android Fire SDK, but there will be others around analytics kind of coming up. And we're also available on kind of chat.fire.org and things like that. So if you're interested to learn more, or you want to join a developer call, this is really for people that are getting technically, starting to build with the components, have questions, want to learn from others that are working with that. Please send us an email and we'll share some details with you. Great. That's all I had to share today, and I'm really pleased to take any questions. And I hope that kind of helps to round out in many ways, like some of the things that we've been discussing about how these enabling technologies can really kind of connect the standards, can bring the content to life, and then of course through architectures we're able to then build solutions that can be a part of a broader digital health architecture and ecosystem. Okay.
Yes, thank you very much, Fred, for the wonderful presentation. There's some questions here. I can read them out. I put some in the chat about the FHIR data pipelines. Can they handle unstructured data? And the next one is related to one that I'm seeing from David Saruni. So I asked whether there are plans to integrate some AI in the future to handle unstructured data. And Saruni asks whether large language models can be designed to operate offline in low resource settings, like in areas with limited connectivity using the Open Health Stack. So your take yourself, and can see Jing is also here. So so participants, those are the initial questions. Please keep the questions coming as the first round is responded to.
Sure. So let me just, so first of all, I think maybe I want to make sure, like, to reiterate the point that, with Open Health Stack, we're providing a set of foundational capabilities, right? So today, getting from like the data pipes relies on there being FHIR data at the source, however that, whether it's a FHIR server, or as I said, the data has been transformed. Within OHS itself, we're not doing the transformation from like unstructured data or structured from a different format into FHIR, but there are other packages, or there are other components out there, right? That's a kind of a common problem that we think can be solved in many ways, right? So we would be looking to the community and to the ecosystem, and starting to to explore what those open source or kind of approaches are, and then sharing that, right? Like, we want to see the community also kind of share the solutions to some of these kind of common patterns that they find. So large language models, could be, I think some people are looking at large language models as a way to kind of be able to take unstructured text and try to identify and help to kind of structure that. But I would say that's an upstream problem, and people can kind of look at the capabilities that are out there today and start to experiment and explore like how they might be able to do that.
Okay.
Right.
So there's these 3 questions in the Q&A.
Okay. So can large language models be, David asks, can large language models be designed to operate offline in low resource settings, like in areas with limited connectivity using OHS? So thanks, David. I mean, I think there's a number, obviously this space around large language models has, kind of really taken off very, very quickly. There are some, pretty small, lightweight, open source LLMs that people are starting to explore and to see. I mean, and potentially could be run in offline modes. I mean, there need to be some work to figure out like what's the task that it's being tuned to basically help to perform. So I think that the field is very exciting, and we're kind of, obviously at Google, we're doing a lot around generative AI. I'd say it's pretty early days, and we're excited to see how this evolves. And, I think we'd be really interested to learn from developers and other groups who are starting to kind of explore this space, particularly for the kinds of use cases that you mentioned. I'll invite Jing. Jing, is there anything you want to add there? Jing's our lead engineer on OHS, Android Fire SDK. Yeah.
Can you hear me?
Yep.
Okay. Thanks, Fred. And yeah, this is a really good question, actually. I think I just want to echo what Fred said. LLMs are changing very, very fast, and the field is really like developing at a sort of incredibly fast pace, right? So there are definitely hopes for LLMs to be in the future either be distilled to smaller models or served offline. So I think these things will happen. We just have to give it a bit of time. And if you're interested, please do watch the space, because I think there's a lot of exciting development that's happening today from many different companies. Yeah.
Great. Okay. Kamal asks, what is the possibility of getting the already existing HMAS to be converted to FHIR compliant using OHS? So that's a great question. So as I kind of hinted at, there are, probably the kind of common approach to this would be to kind of develop a FHIR facade around an existing HMAS. So you can do one of 2 things. One could be, depending on whether you are just trying to kind of push data, from one format into FHIR. So if you're trying to migrate data, then you might undergo like a data transformation or a mapping process. And again, there's some good open source tools that are out there, and on the developer site, you can actually get some links to some of those. And there are more, right? So it's important to speak to, technical groups and people in the field, experts like Stephen, who I see just joined as well, right? So that's data mapping transformation. Then you could also build like a FHIR facade. So this might be where you have an existing, system. And a good example of this is something like OpenMRS, right? So OpenMRS, which is a very common HMIS, actually has support, limited support for FHIR for a set of FHIR resources that's basically achieved by having a FHIR facade. And so a FHIR facade allows you to create those mappings between your internal data model and the FHIR resources. And you kind of define which resources. FHIR has, over 200 resources, but you might only really need to support something like 20 in your HMIS, for example. And so that then would make that system effectively ready, to be more FHIR compatible. You can potentially then explore connecting the Android Fire SDK to that. You can certainly kind of connect the FHIR analytics. And so then you can start to use some of the OHS components in a kind of solution like that. Jing, David asks, what is the process for contributing to the Android Fire SDK?
Thanks, David, for the question. So I just typed an answer, but I'll just answer live as well. But please, I think the first step is really just to take a look at the GitHub repository. We have tracking issues, bugs that's been opened by our implementers, PRs that are under review. So take a look at that and have a look at our process of getting code and contributions into the code base already today. And I think if you are interested in taking any issues or you're interested in joining the developers call that we have every other week, as Fred mentioned, please reach out to the team, reach out to us, and then we can, obviously organize that. And if you are interested in taking an issue, you can also just directly comment on the GitHub repo and join the discussion, share your ideas, and be creative, and also learn from others. So I think that's how I recommend is a good way to start.
Great. I'm just going to jump to Denzel and then I'll come back. What are the future developments into integrating with other health informatics systems providers that have working systems, the goal towards collaborative healthcare? So thanks, Denzel. I think, this is an important, again, point to make, which is that, OHS is not a solution, right? It's a set of building blocks, components that you can build solutions around, right? So we want to make it easier for solutions built, because they're more FHIR compatible, to be able to then integrate with existing health information systems, right? So that hybrid architecture that I talked about, you can have a look at the developer website again under use cases as an example of that. But again, we think that there's a space, there are already, open source adapters for different kind of existing systems. And so I think the question is really comes back almost to the architecture, discussion that Stephen, led in the first, which is if there's a vision and a policy and an architecture around using FHIR and open standards to promote interoperability, then, how can OHS help to kind of more quickly kind of fill gaps or build new solutions that can then, more easily interoperate with existing HMIS systems? Okay. I just wanted to cover this. I see David wrote a question about recorded data from the apps. Just want to check this. Where is the recorded data going? So by recorded data, I assume you mean the data that's being collected by the application. So again, the Android FHIR SDK, is used inside an application. As part of that, it does enable like a local data store for like offline capabilities, and then data is effectively synced to a server somewhere, and that server is in control of the the implementing partners, right? So there's no data going to Google or anything like that. I want to make that kind of absolutely clear. These are building blocks that developers are using to build solutions that then get deployed. And so the obvious place where that data would go would be to a FHIR server that was being set up as part of that project or within an existing architecture or infrastructure that exists. Okay. I mean, one point that maybe I realized I didn't make very clearly on the analytics side of things was the importance of being able to deploy analytics solutions into on-prem environments. So one of the big pain points is that there are there are some good like kind of cloud service providers and others, including kind of Google Healthcare Cloud, but for like on-prem deployments, which is a very important need in many countries, there aren't very good kind of options. And so that's where our work on OHS Analytics is also trying to address a gap today, right? So you can deploy that into on-prem settings, and then actually, if there's a need as it scales, you can kind of shift it because of the kind of common formats that we're using to kind of structure the data to kind of cloud-based services, if that becomes an opportunity for you in the future. Okay. I think we'll just try to take a couple more questions. So Kamal asks, how can system architects who are not developers but design solutions as business analysts take advantage of OHS in their designs? So yeah, that's a really good question. I think maybe the answer is to be familiar with to become familiar with the standards, to understand some of the architectural patterns, and really to kind of be knowledgeable about what types of open technologies there are out there. So if you're kind of involved in I suppose if you're designing like a new system to do kind of case reporting or something, being aware of, the importance of like shared terminologies and thinking about, what are the value sets that are going to be important, so that when people are doing data collection, they're using a common data dictionary, right? So that's kind of understanding how FHIR can kind of help to enable that. And then understanding how, okay, if it's a mobile client, how the Android FHIR SDK, can take a FHIR questionnaire and a value set resource and kind of, make that into a data, collection interface very, very easily. So I think it's being aware of the opportunities that are kind of emerging very quickly, and really kind of, thinking about how data is being used, and therefore like how to kind of design systems and design the workflows that are going to promote, better collection and better use of that data across systems. Okay. Other things that you can also think about is, data quality. I think data quality is an area that is often like an afterthought. And so through our analytics work, we want to make it easier to generate, data quality metrics. Obviously on the Android FHIR SDK side, we also allow you to put in like validations and all sorts of ways to try to enhance the quality of data that's being collected at the point of care, but also being able to identify like where there's missing fields or where there's kind of out of distribution data. That's one of the capabilities that we want to unlock through the FHIR analytics work. And so thinking about that and the processes that need to be wrapped around, like how do you make systems produce better quality data, becomes, I think, an important kind of design question. Okay, I think kind of coming to the end, Anthony asks, has OHS been deployed and utilized to achieve interoperability between different healthcare systems and applications in real-world setup? If so, what are some examples of its implementation and how has it contributed to improved data exchange and collaboration? Hardest question for last, so thank you for that. I think that's a really good point. Look, I think the reality is we're at the early stage of really kind of embracing, this kind of open standards FHIR-based ecosystem. So this is where the community is very much like looking to get to these types of demonstrations. And so, as I shared, we shared some stories from different developers. There's some more details about those programs and the kinds of ways in which they're being deployed. But to say, I don't think we don't have an example that we can point to about achieving interoperability in the way that I think the question is framed, but we feel that it's through the kind of combination of these and really kind of by having more solutions built around standards-based open standards and kind of standards-based architectures, in short time we'll start to see more of those types of examples kind of emerge, and really the benefits start to be made apparent. Okay. All right. I think there's any. Yeah.
Just want to add that, Fred, I've been answering some of the questions in the text. So yeah, hopefully, if you haven't got your question, please take a look at the answered tab of the Q&A section.
Oh, okay. Great. Thank you.
All right. Thank you very much, Fred and Jane, and Steve too, for coming for the webinar today. Steve had some bit of audio challenges. I think you've done very well to whet our appetites on the Open Health Stack. I probably just want to mention to all participants that next week, after we climax with a more detailed look at the OHS use cases, we shall be having hands-on starting sometime on Thursday evening. I think we'll clarify the dates and times, but most definitely Friday afternoon and Saturday, we'll have sessions hands-on. And during those sessions, you can, of course, continue with a Q&A to just clarify the use cases. That will be a very interesting time to just actually get a feel of OHS. I'm personally looking forward. I'm one of those very curious people. I've heard a lot about it, but I'd like to actually try my hand at the Open Health Stack. So thank you. to the 84 plus that at some point are able to be with us. We'll be able to resume next week at the same time. Thank you so much, Fred and Jing. Any closing remarks?
No, thank you, Moses and Stephen. It's been great to share this with you, and yeah, we look forward to to next week and hearing some of those more detailed stories, and inviting the next phase of the evolution. So looking forward to it.
Great, Jing.
Yeah, nothing more from me. Thank you very much, Moses, and thank you to the panel, and thank you for the attendees. Look forward to sharing more details in the technical engagement later on in 2 weeks' time. I think that's when the tutorials will begin. So yeah, look forward to that.
Thank you so much, and
thank you all.
All right, have a great evening. It's been great having you all.
Okay.